vaccination from 450,000 doses a day to a peak of more than 900,000. We've matched the NHS's previous record day and then beaten it again and again. And we've met our target of offering a booster to every eligible adult in England a whole month early. As a result, we have a higher level of booster protection than all our European neighbours, with over 34 million boosters administered across the UK, including in England reaching more than 90% of the over 70s and 86% of the over 50s. Together with the evidence that Omicron causes less severe disease than previous variants and the way the public have conscientiously changed their behaviour in response to Plan B, this level of protection means we're in a very different position than during previous waves. I know some honourable members might therefore ask whether this means we can now do away with measures altogether, but I'm sorry to report that hospital admissions are rising rapidly, doubling around every 9 days, with already more than 15,000 COVID patients in hospital in England alone. We're experiencing the fastest growth in COVID cases we've ever known, with over 218,000 cases reported yesterday, although that included some delayed reporting. And potentially of greatest concern, case rates are now rising rapidly among the older and more vulnerable, including doubling every week among those over 60, with the obvious risk that this will continue to increase the pressures on our NHS. So, in response to the latest data, the Cabinet agreed this morning that we should stick with Plan B for another 3 weeks, with a further review before the regulations expire on the 26th of January. People in England should carry on working from home whenever they can, wear face coverings on public transport and in most indoor public places, and take a test before going to high-risk venues or meeting the elderly or vulnerable. All of these measures are helping to take the edge off the Omicron wave, slow the spread of infection, manage the immediate pressures on our NHS, and buy time for the boosters to take effect. And those in Scotland, Wales and Northern Ireland should, of course, continue to follow the rules where they live. Mr. Speaker, faced with these pressures on our NHS, I know some members may